Oh, the pandemic has been especially difficult for those working on the front lines of healthcare. Increasingly, we're hearing about doctors and nurses who are exhausted and burning out. Moreover, the demands of caring for COVID patients comes when the nursing profession needed more nurses to begin with. One estimate from the government found a need for more than 1 million new registered nurses to avoid a nursing shortage. William Brangham looks at the fallout from all of this.
That's right, Amna. According to the Kaiser Family Foundation, roughly 60% of frontline healthcare workers said that pandemic-related stress had negatively affected their own mental health. And that was a poll taken before the Delta variant arrived and filled hospitals up even more. When I was in Baton Rouge General earlier this month, I heard much of the same. An overtaxed hospital, ICUs full of mostly unvaccinated patients, and a nursing staff that had been struggling for over 16 months.
The patients aren't going to stop coming. They're going to keep coming, and there's nothing that we can do to stop that. So, I mean, we have to do what we have to do to be able to care for them. So, yes, we're tired, but we have nurses that are picking up extra shifts and, canceling plans and getting people to watch their kids so that they can come in and help. We have nurses that are coming in that have been on maternity leave and have been doing PRN positions, and they're coming in picking up shifts.
For more on how hospitals are facing staff shortages amid this now fourth surge of cases, I'm joined by Mary Mayhew. She's the president of the Florida Hospital Association. Mary Mayhew, thank you very much for being here. I know you've been talking to hospital administrators across the state, and we know Florida is really suffering with a lot of new cases and a lot of hospitalizations. What are you hearing from them? How are things there?
So, first of all, we have today nearly 17,000 COVID hospitalizations across the state, and that is combined with unusually high volumes of very ill non-COVID patients, along with emergency rooms that are overcrowded and full. So boots on the ground, we are at unprecedented levels in terms of the demand on the system, which is strained. Very few ICU beds, very few beds generally available around the state.
I know that there is a real shortage of nurses to man a lot of those beds. And I know that this was a crisis that preceded the pandemic, but obviously it seems like the pandemic has only exacerbated this.
First of all, nurses are the heart and soul of our hospitals. We have many healthcare professionals throughout the organization. Our nurses, our respiratory therapists, our ER staff. It is nearly indescribable, the physical and mental exhaustion that our nurses and our staff have been under when you're dealing with patients who are lining the halls on stretchers, when you are having to find a hospital, some other part of the state that can take a patient, and you are calling day in and day out to find those beds. It's tough to put into words the stress that's created, the challenges it's created, and certainly the other concern. These nurses have put their own families at risk because of the exposure, or the concern about the exposure to COVID. So it is a lot. We've had our hospitals executives using the phrase post-traumatic stress to describe what they are responding to and preparing for to support their workforce, their nurses, in the coming months and years.
So what is the solution to this? I mean, are there a surplus of nurses elsewhere that you can bring? Can we train more nurses? Like, how do you see the way out of this?
We have over 8,000 nursing vacancies right now. 1 in 4 nurses left nursing last year. 1 in 3 critical care nurses left the profession last year, or left their jobs, at least within their respective hospitals. So we've got to look at the pipeline. We've got to understand how many new nurse graduates do we need, and how much does the system today currently support. We know there are waiting lists typically to get into these programs. We know that nurse faculty, we don't have enough teachers to support not only the current demand, but ultimately the supply of nurses that we need to support. And again, this is both about retention, the workplace environment, what we need to be looking at to support that workplace environment, and then the number of new nurses that we need to be graduating in the next 12, 24, 36 months.
Do you attribute that attrition that you described to the stresses of this pandemic, just the 16 months of never ending and now this most recent surge?
It's important to just underscore these are incredibly difficult and demanding jobs in the best of circumstances. Now you layer onto that nearly 18 months responding to this unprecedented pandemic. And then the trauma that they are experiencing. They've certainly experienced it throughout the pandemic, but now they are seeing healthy 25-year-olds become hospitalized with COVID. They are seeing young mothers die from COVID. The level of trauma from those experiences, we are absolutely seeing nurses that are leaving the bedside, either taking a break from that 24/7 hospital environment or pursuing other opportunities in community practices.
Mary Mayhew of the Florida Hospital Association, thank you very much for being here.
Thank you.